Thank you for joining me to learn more about mindfulness, research, and best practices. I'm Kimberlee Bethany Bonura. You can learn more about me and my work on the web at drkimberleebonura.com, chairyoga.com, and pelvicyoga.com. You can find me on Facebook at Dr. Kimberlee Bonura and on Twitter at Dr. K. Bonura Yoga. If you want to stay updated for when I post new videos, then like this video and subscribe to my channel. By continuing with the video, you, the viewer, are agreeing to and accepting the terms of the provided waiver of liability.
Good morning, everyone. My name is Kimberlee Bethany Bonura, and I am so honored to have so many of you join me this morning to talk about mindfulness strategies for older adults, research and best practice guidelines. I see from the attendee list that we have quite a few people here, and I'm honored that so many of you have taken time out of your day to join me today and talk about mindfulness. Before we dive in, I thought it would be great to practice what we preach and give us all the opportunity to be I see someone just said my voice is cutting in and out. Is anyone else having difficulty with sound? Okay, great. So we're going to, before we begin, I'd like to just take one moment and have us all practice what we preach and be ready to mindfully engage with this topic, to be fully present. So what I would like everyone to do is to close your eyes for a moment and take a nice inhalation and then exhale out and inhale in and exhale out. And we'll do one more. Inhale and exhale. There's some wonderful research out there about the benefits of mindfulness practice that shows that even brief interventions, 1 or 2 minutes of breathing deliberately, of focusing your attention, can shift mood, reduce stress, and really improve overall well-being. So it's a nice opportunity to reset in the middle of your day, or if you're working with clients, to help someone begin to focus and fully be present for your conversation, and to help you let go of whatever else is going on and to be present. So what we're talking about today is mindfulness with older adults. And our agenda has us focusing on okay, there we go. The use of complementary and alternative methods by older adults, defining mindfulness, talking about varied mindfulness modalities, benefits of mindfulness, best practices for referring older adults to other mindfulness instructors, some potential contraindications to consider, and then I'll leave space for questions. If you have questions as we're going, feel free to pop them in the chat box or to save them for the end, whichever you prefer, but I'm happy to answer things as we're going if it is more relevant. Tamara, I'm not running video right now. I just have the PowerPoint up and voiceover coming over for the conversation and presentation. So the purpose of our session, I know many of you are doing this as a continuing education session, so as a review, our formal purpose to support you all is to review the benefits of mindfulness practice for older adults, to provide practical guidelines for mental health professionals interested in incorporating mindfulness practices into mental health care with older adults, and to review strategies for identifying trained mindfulness instructors for referral for older adult clients. As some brief context, the use of complementary and alternative modalities by older adults. A cross-sectional survey of 1,200 community-dwelling older adults, individuals older than age 65, living within the community setting. Almost 63% of them had used at least one CAM modality, and there was a mean of 3 modalities per respondent. Now, it's important when we talk about this, and when I talk about CAM, we're looking at that sort of broad umbrella of integrative healthcare, mindfulness strategies, acupuncture, guided imagery, massage, dietary supplements. A lot of people who use these modalities are self-medicating. 34% of the individuals said they're using CAM for anxiety spectrum disorders, 26.5% for depression, 18.5% for chronic pain, 18% for heart problems or chest pain, 13.3% for insomnia, 12.1% for fatigue. Many of these people, though, are not talking to their doctors or their mental health professionals about what they're doing. And that's an important piece, and we'll come back to that in a little bit. So what is mindfulness? We're talking today specifically about mindfulness-based practices. And from a broad perspective, mindfulness is awareness training. They are activities designed to bring your focus into the present moment. The key, though, is non-judgment. Sometimes when I begin teaching a meditation class, people will think, well, I'm supposed to change my thoughts. But that's not what we're doing with mindfulness. We are not judging our thoughts. We're just noticing them. We're observing them. We're becoming aware of what our thoughts are, what our sensations are. And I think that's a helpful distinction when you're working with people, because it takes off that pressure, that sense that I've got to change my thoughts and make myself optimistic in this moment. Well, that's not necessarily authentic. If you're feeling sad, you're feeling sad, and you acknowledge that. And part of that non-judgmental awareness is learning to separate the emotions, the feelings, the observations from you as the one who observes. So I'm sitting and I'm practicing mindfulness and I'm teaching in a class, and I will say to everybody, observe what you're feeling. And maybe if we have some, maybe if it's a workshop where we have opportunity for discussion, I'll say, what are you feeling? And people will say, I'm feeling angry, I'm feeling happy, I'm feeling sad, I'm feeling worried. And so then we can talk about and work through that. You're feeling sad, you're feeling happy, you're feeling angry, you're feeling worried. But that doesn't mean that you are sad or worried or angry or happy. You are the one who feels. The feeling is just the feeling. There's a lovely analogy that a lot of meditation teachers use of surfing and the ocean, and that the person who practices mindfulness, the person who practices meditation, is a surfer. The emotions are the waves. So when we're feeling sad, or if we're dealing with chronic pain, or if we're grieving, it may seem endless like the ocean, but we can learn that those feelings, the despair, the pain, whatever is going on is a wave, and we can learn to ride it, and we can learn to manage it, and eventually the water calms. But it's that helpful distinction between who you are and what you feel, and then learning to just feel it, not judge it, not change it, just be there where you are. So when we look at different mindfulness modalities, there's yoga, which is the Sanskrit word for union. And for those of you who've practiced yoga, you know that it's an integrated practice combining physical exercise, those asanas that are what most people think of as yoga in America, but that's only one component. There's deliberate breathing practices, pranayama, where we're controlling the breath. There's focused awareness, which is the mindfulness component of yoga. If you're just doing the yoga exercises and you're thinking about your day and you're thinking about what you're going to wear and you're thinking about those sorts of things, that's not actually doing yoga, that's just doing exercise. The mindfulness is what truly makes it that holistic yoga practice. And then there's relaxation strategies that are important in the yoga practice as well. There are some other components as well around awarenesses and dietary practices, but those are usually for more experienced yoga practitioners, and they're not as integral if you're working with individuals who haven't done mindfulness before. I think that the key components when you're teaching mindfulness within a mental health setting is the breathing, the awareness, the relaxation, the focusing. Tai Chi and the martial arts are other mindfulness modalities. Meditation as a standalone practice. There are forms of meditation like chi walking, where you can do meditation as a moving practice. And then there are standardized medical interventions like mindfulness-based stress reduction, which has a great deal of empirical research on interventions for a variety of health conditions. It's been shown to help with addiction, with smoking cessation, with chronic pain, in treating a variety of conditions. Using one example of the research on yoga for mental health, as I said a little bit earlier, CAM practitioners in general tend to use tend to use their modalities without speaking with their doctor. And I see a question that just came up that said, is guided visualization a mindfulness modality? And I would say it absolutely can be. It depends on how the tool is applied. If you are using guided visualization in a way where you're asking the person to be very focused on what they're feeling now, that is definitely a mindfulness modality, because it's that awareness of the present moment. But it can also be a separate strategy if you're doing guided visualization and you're visualizing outcomes, for instance. Then that's less of a mindfulness modality. I think there's a lot of interesting discussion in the research about visualization and visualizing scenery versus visualizing outcomes versus visualizing practice. That's a whole interesting conversation in and of itself. Most of the research on visualization, it's more effective when we use it to visualize the practice, what we can do, versus the outcomes. So if you're thinking of, from sports psychology, a runner, visualizing yourself out running and how you'll work through when your muscles hurt and when you're tired, that's a very effective form of visualization. Visualizing yourself coming in first in the race is less effective because you don't have control for what the weather's going to be like, who else is running, and those sort of external factors are harder to control for. So I think when we keep visualization more focused on the individual and their body and what they can do, we can practice it in a mindful way. And yes, I see a comment that mindfulness can be empowering because it allows you to detach from your emotions, and that's so very true. It allows, and that is about exactly why I talk about the feeling as being separate from the person. We sometimes relate a lot to our feelings. There's a great writer out there, and I'm blanking on his name right now, but he says, you'd never say if you had a broken arm, I am broken. But if you're feeling sad, we say, I am sad. We take our feelings very personally, and yet our feelings change. We take our thoughts very seriously, and yet our thoughts also change. And so the power of mindfulness is to help us realize that thoughts change, feelings change, emotions can change, and so we don't have to feel defined by them, and we don't have to feel pressured to change them. The lovely book from the 80s, there's been modern versions out, but How to Talk So Your Kids Will Listen and Listen So Kids Will Talk by Adele Faber and Elaine Maslish. It's all about when kids feel things. They've had a horrible day and they come home and they're very angry, and the parent tries to talk them out of the day. Oh, you'll be better, or don't take it so seriously. The kid feels worse because they haven't been able to authentically feel the emotion. But the parent is worried, well, if I empathize that the day is horrible, then they're just going to feel even worse. But there's this sort of counterintuitive thing that when you feel and acknowledge your emotions, it's easier to let go of them. You don't feel like you have to hold on to them as much. So when you're feeling sad, if you let yourself sort of sit and wallow and feel that sadness, but then also recognize you're not the sadness, it's just something you're feeling, it gives you that sense of awareness, that sense of emotional support, and then it's easier to realize you're not the thing that is sad, you're the person that's observing the sadness. Yes, the title of that book was How to Talk So Kids Will Listen and Listen So Kids Will Talk. Truly a wonderful book, and really offers a communication-based approach to talking with children, acknowledging their experience, describing what's going on and letting them resolve their situations. It's not a mindfulness book, but they have a very mindful perspective to parenting. So it felt like a nice analogy. Why don't I pause before I talk a little bit more about the Yoga for Mental Health statistics, and just, are there any other questions about what I've said so far? I've been responding to stuff that pops up, so if anybody else has other questions that they want to pop up in the chat box relevant to what we've talked about so far, please do so. I'll pause for a moment. Okay, well, as things come up, keep chatting them at me. When we look at yoga for mental health as an example, yoga practitioners are in many cases taking yoga classes, practicing yoga to promote their own well-being. 63.7% of yoga practitioners report implementing yoga techniques for wellness and preventative benefits, and 47.9% report implementing yoga techniques for the management of specific health conditions. But only 53% of them are reporting their use to their primary care practitioner. So that's a whole lot of people self-treating for anxiety, for stress, for back pain, for all sorts of things that they're not talking with their doctor about. And that's problematic, because it's better to have a holistic approach to your health care. CAM modalities work best in the research when they're integrated into the overall healthcare process. The difficulty, of course, is that, you know, especially in modern healthcare, people go to their doctors, they maybe have so many minutes, and the doctor may not have time. Sometimes doctors are not aware of and open to CAM modalities. If a person has one bad experience with trying to talk to their doctor about CAM modalities, they may not talk to future doctors. I think you all, as mental health practitioners, you all have a little bit more time with your clients, and so you might be a safe space, especially if you have a good open communication, that you can open the door. CAM is complementary and alternative modalities, so mindfulness, acupuncture, dietary and herbal supplements, massage therapy, yoga classes, Tai Chi classes, all of those things are things that can absolutely impact the health. They can support health. Sometimes they have contraindications for certain health conditions, and it's helpful to be aware of what your clients are doing. And so if you have 45 minutes or an hour with a client and you're building a good relationship and you have space, you can find out what else they're doing and offer supportive insight about how their complementary strategies can support their health. Having that open-minded dialogue can really support your clients in using mindfulness strategies and other CAM approaches in a supportive way. Let's look at what the research says. Okay, I see another question. I'll repeat one more time. CAM is complementary and alternative modalities, the yoga, the mindfulness, meditation, acupuncture, relaxation strategies. It's a big bucket, but usually when the National Institute of Health does overall research, they tend to be clustered together in looking at frequency of use and whether or not people are talking with their practitioners, those sorts of things. The research on outcomes, though, tends to be more focused on specific modalities like meditation or yoga or Tai Chi or massage, those sorts of things. When we look at mindfulness strategies, there's a great deal of research that shows the empirical benefits of mindfulness strategies. Stress management, obviously, is one of the benefits of mindfulness-based strategies that we've been seeing for the longest in the research. There are studies going back to the 70s about the benefits of meditation for managing stress, reducing high blood pressure, for instance. Research continues looking at yoga, meditation, Tai Chi, and finding that all of them have the ability to help reduce stress, help people learn better management of their stress, helping to reduce anger, to reduce anxiety, to reduce symptoms of depression. Some of the research that I have done, I've worked with older adult populations in community centers, in living facilities, and found that mindfulness interventions like yoga tend to reduce anger and anxiety and symptoms of depression more than exercise without the mindfulness component, and also more than social interventions that do not include exercise. So it does seem to have an increased benefit for improving mood and the ability to manage mood. There's also benefits in the research about pain management. There have been studies about yoga and meditation and mindfulness-based stress reduction, about managing chronic back pain, about managing the pain that is inherent in cancer and cancer treatment, post-operative pain, all of those things. We find that mindfulness can be very helpful. There's a program for chronic pain out of the Mayo Clinic that looks at pain management through a mindfulness-based approach. And, you know, with our current world with the concern about opiate addiction, it's very helpful research to understand that acute pain and chronic pain function very, very differently in the body. And opiates are, while very effective for acute pain, they're not effective for chronic pain. And in some individuals, they can actually exacerbate chronic pain and make it worse. And so we understand from a pain perspective and a neurological perspective that chronic pain begins to operate along different neurological pathways in the body. There's the experience both of the pain itself and of the emotional reaction to the pain, and that can make the pain feel bigger and worse and harder. And so in the pain management programs that are mindfulness-based, you support individuals in learning how to, again, going back to what we discussed earlier, observe the emotion, not try to change it, but to just notice, what am I physically feeling that's pain, and what am I feeling that's my anxiety, my stress, and my fear about pain. Sometimes when you're in pain, if you have patients that you work with chronic pain, there's a great deal of fear wrapped up in it, because when you're hurting and you think you will always hurt and the hurt will never go away, it's a very scary, terrible thing. And so if you can support the individual in separating the emotional response from the pain itself, they might not be able to control the pain itself, but they can control the emotional response, which does over time seem to reduce the subjective experience of pain. So there's a lot of very interesting research about pain management. It's very, very helpful. If you're interested in pain and trauma in particular, I'm going to type into the chat box an author's name, and I'm going to say the name of his book. His name is Padmasree I'm missing a letter there. I'm trying to type and say it at the same time for you. His name is Padmasree Da Silva, and his book is called Emotions and the Body in Buddhist Contemplative Practice and Mindfulness-Based Therapy, Pathways of Somatic Intelligence. It's not an easy read, certainly not a fun beach read, but it's a very technical book, but it really gets into the pain neurological process, the process of trauma in the physical body, and how mindfulness-based practices within the Buddhist tradition can support patients in working through their emotions, becoming more accepting, and how to reduce that pain. And yes, Diana, thank you for your note that you're working with patients and helping them to accept the pain, and then that somehow that relieves and reduces their pain. It feels quite miraculous, but it really does work, that somehow getting a grip on the emotions about chronic pain can make chronic pain more manageable. And again, it doesn't make chronic pain go away at all, but it helps to manage the effects and the broader context of chronic pain. Yes, the book's name, I will repeat that again, is Emotions and the Body in Buddhist Contemplative Practice and Mindfulness-Based Therapy, Pathways of Somatic Intelligence. And I believe the author, Da Silva, has one or two other books, but if you look for him, it'll be one of the options that you find from this author. Mindfulness-based strategies are also wonderful for insomnia, for improving sleep quality, for reducing time to sleep onset, for reducing the number of wake-ups during the night. There have been interventions about yoga, meditation, mindfulness-based stress reduction, Tai Chi, and across populations. There have been studies with yoga in children, yoga in older adults, parents. They all seem to improve sleep quality. And, you know, we know the current and contemporary research on sleep, we know how important sleep is to well-being. We know, for instance, that children with ADHD who don't get sufficient sleep have a worsening of their symptoms, and when their sleep is addressed and they sleep longer quantity and better quality, their symptoms tend to improve. We know for adults with pain-related conditions like fibromyalgia, problems with sleep can exacerbate the pain and make functioning more difficult. So sleep is such a foundational and fundamental aspect to well-being, to health promotion. And mindfulness-based strategies really do improve and support sleep quite miraculously in ways that people who've been struggling with sleep are often surprised once they begin taking classes. I can say as the years before I returned to graduate school when I taught yoga full-time, I'd always have students who, after a good hour of yoga practice, you put them in Shavasana, they lay down on their mats, and a few minutes later you hear snoring because finally they're getting some rest, they're getting some ability to let go of the mind and to just fall into that sleep. And so an example of help with sleep, people who have insomnia, for instance, of the kind that makes sleep onset difficult, may find that doing a mindfulness-based practice right before bed helps to improve their time to fall asleep. So doing, and not, you wouldn't want to do a hot yoga class or an Ashtanga power yoga class right before bed, but doing a very restorative, taking your shower, getting into your pajamas, and doing a restorative yoga practice right before you go to bed can help your body calm and quiet and relax and go to sleep. Some of it could be that by doing that you're not watching screen time and you're getting away from the blue light, and so you're decompressing and you're physiologically slowing down. Some of it, though, also I think is the quieting of the mind and the working through of those thoughts and emotions that allows you to fall asleep better. I found for people with insomnia, when I've worked in yoga therapy with people with insomnia, that if you teach them some meditation strategies that they can do, then when they wake up at 2 in the morning, they don't check the clock, they don't get up and check their email, they don't go have a snack, they stay in bed and they do their meditation. And you try to reframe it that maybe you don't fall back asleep right away, but either way you're resting, you're physiologically relaxing, and by doing the meditation it helps the mind to stop wandering and you find you fall asleep more quickly. Yes, Diana, lavender oil, essential oil is fantastic for helping sleep. It truly is. If you get, Susan, you've asked if you get up a lot of times each night. Sometimes mindfulness is very helpful. Sometimes, though, if you're waking up a lot in the night, it can also be about sleep hygiene, the temperature of the room, the types of sheets, noise, light into the room. So that's a place where you might look up into sleep hygiene and get some perspective about how else could you support the sleep quality. I will, when we get through the end of the session, I've got some recommendations about a book on sleep that I really like, but I have to go look that one up. So I'll come back before the end of the session and share a book recommendation that I really like about addressing sleep quality and sleep hygiene in particular. For older adults, mindfulness strategies are also really helpful with activities of daily living. I found when I have taught yoga in older adult community centers, for instance, that one of the great concerns, of course, is maintaining independence. There can be a great fear of falling, and helping to improve awareness of self, balance training with Tai Chi and yoga, that physical strength training so that you can get up and down off of your chair by yourself. All of those things facilitate that activity of daily living, that sense of self-efficacy for daily living as well. I just noticed, Diana, you also had a chat about sleep being an internal indication of what's happening in your body, and that's so very true. It's also an indication of what's happening in your world. If you're a parent of young children, if you're a caretaker, often you will wake up many times in the night because you hear noise. You want to check on the individual that either your aging parent or your spouse or your child. And even after you've moved out of the caretaker role, your body maintains that memory and you have to retrain yourself. If you've got any illness going on, if you've got stress going on, if you've got hormonal shifts based on age, all of those things can absolutely impact sleep quality. So mindfulness won't be the magic thing that fixes everything, but it can help you improve the quality of sleep within the context of your body, your health, and your life. Before I move on to the next slide, which is talking about referring older adults to mindfulness, are there any other questions or thoughts? Okay, discuss trauma and mindfulness. Yes, there's some Interesting research emerging, work at VA centers about the use of mindfulness strategies in treating trauma, in addressing PTSD, for instance. And I gave a presentation a couple years ago at the American Psychological Association about using mindfulness in military populations. And one of the questions that people had was, well, if somebody has PTSD, how do you work with them in a mindfulness way so that you're not revisiting that trauma? And of course, that's a very challenging situation. But I think what the research seems to show is that in PTSD, neurologically, individuals get stuck in an experience, and so it's harder for them to stay in the present moment because they're always being pulled back to that experience. And so mindfulness is a way to help them learn to control their awareness, to control their focus, to undo some of that neurological stress and create new neural pathways. The emerging research using MRIs, studies of individuals who practice mindfulness, there's been some studies that look at experienced meditators using MRIs, and they find that there are truly brain differences in people who consistently over extended periods of time practice mindfulness. They have lower responsivity to pain, so they're more able to manage their pain response, those sorts of things. There's also studies that show when you practice mindfulness for a short period of time and they do MRIs before and after, that there are structural changes in the brain. So the brain is much more plastic than perhaps people thought a few decades ago. And even in older adults, you can show new neural pathways, you can show growth in response to mindfulness training. And so I think all of that feeds into the work about trauma and mindfulness. It's still definitely an area of emerging development, but it's very promising that it appears that when you work with individuals who've had traumatic experiences and help them to learn this sense of self-regulation, and that to me is what I think is really the core of why mindfulness-based therapy works, is because you learn self-control. You learn that your mind doesn't control you, you control your mind. And if you've ever read any of the meditation teacher Jack Kornfield's work, he says that in many ways our minds are like new baby puppies, and we bring them home and we put the paper down in the corner and we put them on the paper to go potty, and then they run and they pee in the corner, a different corner, and we clean up the pee and we take them back to the paper, and then they run in the corner and they pee again, and we clean up the pee and we take them back to the paper again. And so our mind is like that. We sit down and we say, I'm going to meditate and I'm going to focus on my breath. And then suddenly we remember we're angry at our husband or our wife for not doing something. We say, no, I'm meditating. We bring ourselves back to our breath. And then we remember what our boss did yesterday. And we bring our mind back and we're breathing and we're focusing. And our mind runs off and thinks about what we have to get at the grocery store later. And we bring it back. So our mind is this puppy running off in a million directions, but we keep bringing it back. And that practice, that training of bringing it back over time, teaches us that we can control our thoughts. We can purposefully bring ourselves back to this moment right here where we are breathing. And that can be a powerful lesson in that sense of self-regulation and self-control. Janina, I see your note about some resources that show benefits about PTSD. When we get to the last slide, I have my email address there, and if you wouldn't mind sending me an email after the session, I can send you a reference list about the use of mindfulness for military populations that might point you to articles and things that you're looking for that you might find of help. Diana, schizophrenia and mindfulness, that I see your question asking about to discuss that interaction. I have not personally done any work in a clinical setting with individuals within that population. I know that some of the research indicates that for certain psychological disorders, schizophrenia, bipolar, there are certain types of pranayama that you need that are contraindicated because they can actually increase arousal, and they may actually they can be problematic. You should avoid certain, like some of the hyperventilating pranayamas where you breathe very fast and very rapidly, like breath of fire in the Kundalini tradition. I'll offer the same thing as Janina. If you send me an email afterwards, I am sure I can find you a few articles or books that you might find relevant if you're working with individuals with that population and you want to incorporate mindfulness strategies in a safe way. So when we are interested, Susan says that she used to work with schizophrenics and you were not allowed to do mindful things. And I think 10, 15 years ago, I know when I was gathering data and articles for my dissertation, and I was interlibrary loaning, obscure journals from India and gathering all the things that had been published. And now there's a great deal of content published about yoga and meditation and mindfulness for health, but 15 years ago it was harder to track things down, and it was still less common. And that was sort of the common thing, was to say for people with schizophrenia and bipolar, do not practice mindfulness. It's contraindicated. But I think there's probably been some growth and evolution. I know I'm currently working with a dissertation student who is looking at the use of mindfulness with adults with intellectual disabilities to reduce aggression. So I think there is an awareness that there are opportunities in safe ways to support groups that perhaps in the past people haven't used mindfulness with, but that there are benefits if it's done within an appropriate context. Yes, Rosalind, please also email me and I'll send you the trauma resources as well. So when we refer older adults to mindfulness, it's very important to be familiar yourself. I think that if you want to refer somebody to yoga or to Tai Chi or to meditation, you need to try that modality first to see how you feel. And you should try out teachers in your area so that you have some people who you feel comfortable referring to, who you know will be supportive and appropriate. There's also, lots of research now. There's grants funded by the National Institute of Health. There's books about using these sorts of therapies, and so you can have that base level of information to support. Lisa, when you've asked about using these approaches with older adults, not every yoga format is going to be appropriate for an older adult group. Hot yoga has become very popular. With the exception of extremely fit adults with absolutely no cardiovascular risks, I would personally not refer an older adult to a hot yoga studio. It's very fast-paced. It's very hot. They don't have the level of personal attention, and so I would be concerned about health contraindications. There's a lot of different types of hatha yoga instructors. Some have a very gentle approach. Some are much more strenuous. My own mother actually had to have reconstructive knee surgery after a yoga teacher adjusted her and her knee popped, and she had to have the tendon reattached, and that was sort of the beginning of my path to becoming a yoga instructor, because I wanted to learn how to support older people practicing yoga in a much safer way. So I think you need to know the teachers in your area. You need to know who you trust to refer your clients to. And as you're looking for people, you want people who are certified through an appropriate organization within their modality. And I have a reference sheet that I believe we're going to share with you all at the end or in some way through this chat that gives you the organizations that you'd be looking for in yoga, in mindfulness-based stress reduction, in Tai Chi and Qigong, so that you could find instructors in your area who have at least minimum standards for training. You want to make sure that if you're referring older adults, that the individuals are trained in sports medicine standards for the American College of Sports Medicine standards for older adults, so that they know how to review in case of medical conditions, how to support individuals with a variety of health conditions. You want to make sure that when you're referring your clients, they're going to someone who's going to treat them with the same care and concern you offer. Contraindications, because they're important, especially if you're working with an older adult population. As I said, I don't like hot yoga for older adults. Personally, I don't really like hot yoga. I worry about a lot of aspects of it. I know the theoretical framework is that if you practice yoga in its traditional context in India, it would be hot, and that is true. But then you wouldn't get in an air-conditioned car right afterwards and drive home to your air-conditioned house. So I'll leave that as that. Being aware of stress on joints for individuals with arthritis, osteoporosis, any other issue that could put an individual at risk for a fracture means that if you're looking at yoga or Tai Chi or the martial arts, you want to be very mindful of what the modality specifically is like with that instructor in that environment. Some yoga classes, some martial arts classes do some inversions. For instance, in yoga, you've got shoulder stands and headstands and those sorts of things. If individuals have glaucoma, ocular pressure, other issues related to pressure in the head, those kinds of inversions may be inappropriate. So you want to make sure, again, that your clients are talking to all of their physicians and getting the appropriate referrals. As I said a little bit earlier, pranayama can be contraindicated for people with bipolar, also anxiety and panic disorders based on the type of condition. People who have a history of panic attacks definitely should not do breath of fire because it's a very fast-paced, rapid breathing. And for an individual who has a history of panic attacks, it can feel like the way your breathing begins to speed up in a panic attack. And so it can actually, it has in some individuals triggered a panic attack. So that would be something that you would only want a patient with those conditions to work with an experienced instructor who was aware of the patient's background and how to manage and support safely. Whenever we're talking about mindfulness, if we're looking at movement practices, we want to remember that pain and strain are not appropriate. If they're hurting in any way, they're probably being pushed too far or the practice isn't appropriate for them. We want to be mindful of fast movements, especially if anybody has balance or circulation or joint issues or replacements. And from a mindfulness perspective, I think it's also really important to let go of perfect. I love Diana's note about listening to your body, let patients know there's no judgment. We want to let go of perfect. Perfect can lead to injury. We want to focus on the internal process. How do you feel? How does it make you feel? What's going on with your breath, with your awareness? You know, if I'm teaching a yoga class and someone has a physically perfect triangle pose, for instance, but in their head they're thinking about their grocery list, that's not a perfect triangle. But if somebody is doing a triangle that barely approximates triangle, but they're really inside focused on what that feels like, on the turn of the leg and the lift of the arm and the pacing of their breath, then that's a mindful triangle because it's all about the awareness. So, you know, some final thoughts. As you're thinking about mindfulness strategies, using them in your practice, referring your clients to mindfulness instructors, have an open dialogue. Give your clients space to talk about what complementary and alternative modalities they're already practicing. Maybe share which ones you have found beneficial and might find appropriate for them. Recommend mindfulness as a form of self-care. You know, in our very busy culture where people think of busy as a status symbol, self-care can often be forgotten. And so people get frazzled and run down and worn out. And mindfulness is a way of taking time to take care of yourself, to nurture your own well-being, your own peace of mind, and to manage your stress. And that's helpful for you all as well in your own lives, and that's a way to frame it for your clients, that this is important because it supports your health and it helps you take care of yourself. And also remember, of course, that there's a lot of different ways to practice mindfulness. Hopefully I've given you a nice sampler set today of things that have sparked some interest that you can read more about, look into, try yourself. Find the one that best suits you, find the one that best suits your clients, and because there's so many different kinds. If you don't like one kind, try another. One person might love the chi walking, another person might prefer yoga or Tai Chi or a seated meditation. And I think actually we're at perfect timing because if you've got questions, you can virtually raise your hand and pop things up. Or, Lourdes, do we turn on mics or do they just ask questions within the chat? Okay, so chat box, please. I know you guys have been asking questions throughout. I have seen several questions from people about follow-up information. So let me go ahead and, while we have chat put up, here is my email address and my website. If you want to follow up and ask for articles or resources, I am more than happy to share that content and information. Amanda, I know I provided you all with a PDF reference list. How can our attendees get that as well? Okay, so it looks like that is up. Are they able to download that? Okay, they can download over on the side. Fantastic. And it also has my email and my website on it. What I've got on that sheet for you all are organizations that you may find helpful in finding instructors in your area who are trained. For yoga, we're looking at Yoga Alliance for Certified Registered Yoga Teachers, the International Association of Yoga Therapy for Yoga Therapists, Center for Mindfulness for trained mindfulness-based stress reduction, 2 different organizations for Tai Chi and Qigong. I also offer some recommended reading online websites that are helpful about complementary health, about mindfulness-based stress reduction, about exercise for older adults, and then some articles and books that you may find helpful on the topic. Suzanne, thank you very much for your very kind note about that this is a simple way to heal from a more than stressful world. And I think that's part of the beauty of mindfulness, is that there's so much that's so complex and stressful, and sometimes when you start thinking about self-care and self-help, it can feel like this overwhelming list of do all these things and do all of this and do 1, 2, 3, 4, 5, and you feel more stressed. But mindfulness you can take anywhere, and if you just take a few practices, you know, it's a tool you've got in your toolbox anywhere. I recently shared some resources with a woman who works with military family members, and from my website she pulled a little 15-minute video of a chair yoga session, and she shared it at a workshop, and she came back to me and she said, and you know, they all said, oh my gosh, I can do this at work in my chair when I'm feeling stressed or worried. And so she and I talked about that. That's the beauty of this toolbox of mindfulness, is you don't need a gym, you don't need equipment, you have it everywhere you are. So if you're in the line at the DMV and you're frustrated at the length of the line, you can breathe. If you're, you know, Susan just said she meditates in the morning and before bed. Absolutely. You can meditate first thing in the morning to set your intention for the day. Meditate right before bed to help you relax and settle down and sleep well. When you're at work, 2 minutes. It's a thing you can do before a phone call, before a presentation. There's so much that you can do to help with that. I see several of you have given very kind comments, and I appreciate all of that positive feedback. It's truly been an honor to spend this time with you this morning. I appreciate all of the interaction and the engagement and the feedback from those of you who have used these strategies before, offering your experiences. I know I've said it a couple of times, but please feel free to email me. I'm happy to answer follow-up questions specific to your work and what you do, and to point you in the direction of resources that you may find helpful. Oh, the sleep. Yes, there was I said I would try to get that reference for you guys about sleep. Let me open that up really quickly. I have that in something I sent recently. There is a lovely sleep book called Sleep Soundly Every Night by Robert Rosenberg. He's a sleep doctor. I know you can find that book on Amazon, Kindle or PDF or paperback. It's a great book. And it really focuses on sleep hygiene, different sleep conditions that people might be aware of. Thank you, Lisa. I think the cautionary statements are important, because I think sometimes people just jump in and think it's always great, it's good for everybody, and everything requires a certain amount of caution and practice and making sure that you're not contraindicated. So I think even good things have to be approached carefully and purposefully and, dare I say, mindfully. David, I see your note about coping skills for adults with substance abuse. There is some research about mindfulness strategies for substance abuse. The student dissertation I just mentioned the other day, he was citing in his research about mindfulness-based stress reduction for adults with intellectual disabilities in smoking cessation, and that was a successful approach as well. Yes, the sleep book is Sleep Soundly Every Night by Robert Rosenberg, and I just put it in the chat box as well, so you can grab that name and the author's name. I'm looking to see if I have missed any questions in the chat box. I want to make sure that I've addressed everything that you guys have placed up there. I don't think I've missed any questions, but if mindfulness references for adult ADHD, well, that's a great question. I know I've seen and read and cited studies about ADHD in children. I am not sure if I've seen any research studies about ADHD in adults and mindfulness. I would hazard a guess that the benefits would be there because the research shows that it's effective for children with ADHD. If you wouldn't mind sending me a note, Carol, I would be happy to see if I can find something for you. Diana says, any thoughts on suicidal patients? Boy, that's a tough one. I mean, we know, for instance, people with severe depression, that early treatment is sometimes the difficult window that requires a lot of support and watch, because if somebody who's been so depressed and lethargic begins to feel just enough better to have energy but not better enough to feel better about themselves, that's when the suicide risk spikes. So mindfulness is, of course, very, very, would have to be handled carefully and cautiously. I would say if in a patient like that, Diana, you've had several chats. It seems like you do have extensive mindfulness experience. That would be something where probably instead of referring out, you would want to work one-on-one with an individual in a therapeutic setting so that they had support. I think the trauma literature, as you note in your chat, probably would be very helpful and relevant in that context, because you'd want to be framing it in a way that helps them learn to manage how they're feeling, working through whatever past traumas have impacted. I think for severe depression, I think there absolutely, from a mindfulness perspective, is the sense that you become absorbed by your emotions and when you're feeling that level of depression. And so where mindfulness could be helpful is that sense of separation from the emotions, to feel that you're not defined by your emotions. But again, I think you'd have to handle it very carefully in a one-on-one setting to make sure that the patient had support and encouragement and that safe space with you to answer questions, to address concerns, to be kept in a safe environment. I hope that's helpful.
All right, wonderful. Well, we are just about out of time. I'm going to put the poll up here for us. And thank you so much, Kimberlee. This was so enjoyable. I really feel like I have a lot of takeaway points and just paradigm shifts, really. I mean, I've been, you have one perspective and then someone presents and then it gives you a new kind of fresh outlook, and I really appreciate that. So everybody, please go ahead and put in your information in terms of your continuing education hour evaluation. And if you have any questions, please feel free to reach out. We've got 5 minutes. The other session, the noon session, is open. You can go ahead and log in. That presenter will get started right at noon. Again, Kimberlee, thank you so much.
Oh, it's been my pleasure. Thank you for having me and giving me the opportunity to present. And I know right at the end we had a few questions pop up as we were doing the poll, so if you all want to email me, I'm happy to have some further conversation. Amanda, thank you again for having me. It's been a really fun hour for me too, and I appreciate presenting to such an active and engaged group.
All right, everybody. Well, it looks like you all submitted your poll. Thank you so much for your great participation. See you in the next session. Bye.
Thank you for joining me to learn more about mindfulness research and best practices. If you like my content, please subscribe to my channel to stay updated for new videos. I'll see you next time.